Hello and welcome everyone to Community Impact. I am Reverend Tanya Hill, Director of Community Impact for First Baptist Church North Indianapolis. And today I would like for you to welcome with us, we have Stephanie Patterson. She is a retired business analyst and a solution trainer, now working as a church administrator for First Baptist Church North Indianapolis. We also have Mr. Shadrach Kamwindo, Congressional Partnership Manager for the IU Health Faith Initiative, and Mr. Jay Foster, Vice President of Spiritual Care Chaplaincy and Congregational Partnership. So we would like to thank Dr. Hicks for bringing us all together and allowing us to showcase this awesome program that you have. So we do have a few objectives for today. First, we would like to showcase this anti-social isolation program that is so needed right now, and the certain positive impact that it will have on health and recovery of patients in the Indianapolis area. We want to leave this interview today with the understanding of the need for the biblical basis of such a program as this. Learn what exactly the program is, what it offers, and how it began, who the participants are, most importantly, how the community can support this. So we will get right in today. So first, if you could all take a little turn and share with us what your role is with the program. And we could start with Mr. Shadrach.
Thank you so much, Reverend Hill. My name is Shadrach Kamwindo. As you said, I'm the manager for congregational partnerships here at IU Health. So my role is to bring, almost like an ambassador out there, to bring together these congregations, to get to know them and build trust with our system and to walk alongside with you guys as you do ministry. Because the congregations do this every day. They take care of the shut-ins, the sick, and everything else that comes in the community. So why not come along with the congregation and do this work?
All right, thank you. So you serve as an ambassador to the program. So would I say, would this be accurate that you connect congregations in the Indianapolis area with the programs that your chaplaincy program offers there?
Absolutely. Okay. So that's my day-to-day, reaching out to congregations, sharing about what we are about to venture out here at IU Health, and see where it takes us from there.
Okay. Well, thank you so much for sharing. Miss Stephanie.
Hi, Tanya. As you know, I'm the Council of Ministries at First Baptist North. I'm also your Christian sister, and I'm the team lead for this isolation project, working with Shadrach and Dr. J.
All right. So you're our connection for First Baptist North.
Yes, I am.
Thank you so much. Good deal. Mr. J. Foster.
Good morning. It's delighted to be with you all. So a little bit about me. I'm a chaplain for the last 30 years in the hospital. And it's been my privilege in that ministry to be able to walk with people during some really tough days in their lives. And it's a really rich and meaningful ministry. And my ministry's really been focused inside the walls of the hospital. Well, part of what drew me to IU Health and to this role was the idea, can we take what we've learned inside the walls of walking with people on difficult days and partner with congregations just like First Baptist North Indy to care for our neighbors who are having a hard time. And so the ministry we decided to focus on was what we're calling social isolation or loneliness. Those are two different things. You can be socially isolated, but really not be all that lonely, or you can be lonely in a crowd of people. But research shows that both of those ways of being socially isolated and or being lonely, have a terrible effect on your health. If you're chronically ill and lonely or isolated, it's like smoking 15 cigarettes a day. your chance of mortality raises a bit. And so the biblical basis of what we're trying to do is nothing more complicated and nothing more than loving our neighbors as ourselves, alongside and love someone when they're lonely and isolated. In a conversation yesterday with a member of my church, who's a retired professor of pastoral care, and he said he was feeling a little, and he said about himself, you know what, I'm not particularly easy to care for. Come alongside me. So I think part of loving our neighbor as ourselves, and that each of us for a different way for someone to join us, right? All a little different. A lot of the emphasis of this ministry focuses on listening. Slow down and really hear the story of the person who's my neighbor, but hearing it with her or his eyes, so that might hear what this is like for them. The last thing I'll say is we started this idea program about a year ago, where COVID-19 hit. The need for this is all of a sudden so apparent to all of us, so much more difficult. I think all of us are exhausted right now by the pandemic, whether we're ill or whether we're perfectly healthy. It is great, and I'm just so humbled and grateful that we get to walk with First Baptist North Indy. Yeah, so we're excited about it.
Well, thank you so much. We're excited too. One thing that you said that stands out to me and actually kind of gives me a little chuckle is that you said that the gentleman you were speaking to, he said he's not all that easy to walk along with. And so a lot of people are not very easy to walk along with when they're sick. But we know the word tells us that you've done no great thing if you only love those who are easy to love. And so we had to roll up our sleeves and be ready and willing to walk along and help people who are not so easy to love. And when you're sick, it's not always the best time for that. So we have to be prepared for that in advance. So with that being said, could you tell me, Mr. Shadrach, how this program began?
So, in fact, Jay would say this better because she has good two stories for his background from North Carolina, but also from Memphis. So, Jay, would you share a little bit how this program started in the South, where you came from?
I'd be glad to, Shadrach. The story begins about 12 years ago. There's a large Methodist hospital system in Memphis, Tennessee called Methodist Laban Hoover. Health system has 10 really large hospitals part of that system. There's a guy named Gary Gunderson. Gary is a Methodist pastor and a public health scientist. Carter Center in the area of food insecurity and congregational partnerships, thinking that congregations know their communities and they know what the needs are and they know what the barriers are. This and written about healthcare, but never done the work. But the CEO of that large health system in Memphis called Gary and said, "Gary, can you actually do this stuff or just write about it?" And I don't know. Nobody's ever paid me to try. But I'll try it. So he went there as vice president of spiritual care and worked with a wonderful pastor and chaplain by the name of Bobby Baker, who began slowly by meeting with congregations for about a year, really, to think of, well, what's the best way to launch this program? That program grew from 12 congregations to 600. Had really good outcomes. Healthcare systems care about this. So been able to show an actual difference, particularly around issues around breast cancer, interestingly enough. hospital readmissions, those kinds of things, was really partnering with congregations to find out what are the assets, what are the barriers to meet needs in the congregation. A flip on the way, hospitals will often come in and say, hey, we're the experts, we'd be glad to help you. Well, no, in the realm of spiritual care, congregations are the experts. Listen and learn. Fast forward about 7 or 8 years, Gary was left Memphis and came to Wake Forest Baptist Health, where I was one of the lead chaplains and director of spiritual care. It really changed my way of seeing this. And, Gary said a simple thing. He said, people don't go to the hospital to get well for treatment. They go home to get well. If they don't have what they need at home, then their road to recovery is much more complicated. So IU Health asked me if I'd be interested to come here, lead in this program, given my exposure to this work in North Carolina. So that's a little bit of the history from where it came from. But it's important to note that IU Health is a leader in the field in terms of taking very seriously how do we change healthcare so that it's really effective. The best healthcare systems in the country right here. But we also have pretty different in terms of people's care. Why is that? We know that about 20% of good health outcomes has to do with access to really top quality healthcare like you can get at IU Health or at Eskenazi or Community or St. Vincent's. Other 80% has to do with things like, what are my healthcare choices? What's my behavior like? Do I drink to excess? Do I, And the other big percentage has to do with where I live. And does my community have access to good and fair housing, to good job and employment prospects? Is my mental health care taken care of? We know that those are areas we really need to devote our energy. This program is one of the ways that IU Health is. I want to thank you for that time. And audio is not so good, so I'll step
thank
off.
you so much for what you shared. Thank you so much, Clay Foster from IU. We appreciate your contribution to this interview. And we know that I will have Shadrach share some specific details about the program, but I would like for Stephanie to share with us what the training process has been and how you went about selecting participants for the first round.
Actually, I'm very excited. I'll start there with this program. I feel honored that Dr. Hicks and Dr. J and meeting Shadrach to be on this project. Here's what I did. Just to cut through the field, I'll steal some of Dr. Hicks's sermons, his phrases. Let me cut through the field. I was on the HIP project a year and a half ago, and that opened my eyes to how the healthcare system is here in Indiana, particularly in Marion County, Indianapolis. HIP being Healthy Indiana Plan. We did a survey on just how the community in our area here at the church in the near Northwest area, how it perceived or how they assess healthcare. What I didn't know is there's a certain percentage of people that use the hospitals as their primary care physicians because they don't really have a primary care physician, or they can't reach a social worker, or they don't know who to reach out to. So that was eye-opening for me. That was, if you will, my first foray into working with congregations in the healthcare system. When that ended and this came along with Shadrach and Dr. J, I was happy that they asked me to do it. because I want to see where it goes from there. Like this project now basically states that we're going to look at being, to me, it's the care between leaving the hospital and going home and getting well. What my group will do is they'll basically, those people that want to be a part of the project, we will contact them and just find out what it is that's stopping them from healing, which could be, hey, I can't get my medication. I don't have enough food to make it to the end of the month. I live in a food desert and a pharmacy desert. Everyone says food desert, but hey, if you don't have a pharmacy, you just got out of the hospital, then how can you get your medication? Someone needs to keep my kids. I can't get back to the doctor. I can't reach my doctor. I don't know what. I don't understand the prescription for what I'm supposed to do after I leave the hospital, and all sorts of things. We're the pilot program. I'm happy to say that we're digging through the weeds and seeing just exactly how this should go. But I'm just excited to be a part of knowing that my team can bridge the gap and be there for someone who just needs to talk, someone who's gotten out of the hospital, someone who may be isolated, someone who might be older and can't get to the doctor's office, or doesn't understand, or doesn't know how to navigate a simple telephone call to find out what doctor or what therapist to talk to. So that's what my team will do. You asked me how I chose my team.
It sounds like that this is really a great support for the hospitals, because based on what you shared, and Jay Foster shared, that this is increasing the bedside manner for the medical professionals, because it's extending the arm a little longer, probably adding to the education process, because I know a lot of times people don't follow the prescription given by their doctors so well because they don't understand it, or they don't know how one thing impacts another thing. And so, like, if my diet is, if I have high blood pressure and you tell me I should eat this way, well, why? And often they'll say what not to eat. Well, don't tell me everything not to eat. Tell me what to eat, and then how I can help that. So, and just listen before you just hear me for 5 minutes and then you're off to your next patient and I don't know what's going on. And you have the benefit of that knowledge, and I don't. So that's great. So then go ahead. Go ahead.
Listening is the biggest part of what we're going to do. But you hit the nail on the head. When you get home and you've been told, if like myself, I love chocolate and I'm pre-diabetic. So telling me that I can't have sugar, I need to talk to someone that it could be a coach for me. Hey, I'm about to go for this candy bar. I need to talk to you real quick. Things of that nature. And we look at it, and yes, it does have a humorous side, but I always think in terms of, how would you like it if your grandmother went home and you were in another state and you couldn't get to her and you couldn't take her to the pharmacy and you couldn't make sure that she understood the doctor's directions? That's what our group will do. And I'll just circle back real quick. You asked me how I chose my team. I know that it was fear driven, because the people that are on the team are in my church, of course, and I would see them every Sunday, but we're in the middle of the pandemic. For privacy issues, I'll just mention the first names. Wanda is our missionary leader, and every time you see Wanda is, okay, I'm here. What do you want me to do? Deborah Bunch always has a smile and a very calming voice, and she always listens. Mr. Hall has I just assumed Mr. Hall, with that beautiful voice of his, he also has that calming nature, and he always listens, and he's always thinking of the other person. How are you feeling? What are you doing today? Anna Lucas She is our director of Christian education. And so Anna has a background in customer service management. So I know Anna's going to be one of those people that listens and knows how to ask the right questions. And then we have Marcella. Marcella has been in the healthcare system herself, in the health industry herself. So I know that she'll be good. Myself, I'm one of those people, like, you know, my bio. I was a business analyst and solutions analyst in the end prior to my retirement. I was aware of I was worked on the HIP program, but I was also aware of the program that Dr. J talked about. I'm hoping that in the long run, and I realize this is down, maybe it may take us some time. I'm hoping that Indiana can adopt the process where there's a gap between the faith health community and the healthcare system.
Good, good. So it was a divine appointment that brought the group together, and everybody has their individual spiritual gift that they bring to the table that can make this a huge success. And so these are very good things. So thank you so much, Stephanie. Mr. Shadrach, could you talk a little about the outcomes that IU would like to see for this program and how they'll be measured?
Yeah, I can speak a little bit about that. Overall, we want to improve social isolation outcome. We want to see when people are walking through health crisis, they are here at the hospital, there's somebody that comes with them. They are not walking by themselves. So loneliness is getting addressed, but also people are getting healthcare at the right time, at the right place. As Stephen alluded in our conversation, that this would give us an opportunity to direct care to the primary care physician, right? So they get to know the patient very well because they have a companion in Stephanie who said, "Hey, let me take you to that appointment." So in that regard, we'll see those outcomes. But in the end, for IU Health, the goal is to make Indiana one of the healthier states. So we hope this will permeate everywhere. A lot of congregations will be on board after hearing what First Baptist is doing, because you guys are doers. Pastor Hicks is a doer in our community, right? So we hope this program, when other congregation hears, they said, "Hey, we're gonna form our team." In the end, we'll have a lot of our elderly people, a lot of people in the shut-ins, they have a companion. Somebody's listening to them. When they are hungry, they know somebody else can bring them food. When they need transportation, Stephanie is on a phone call away. And these are not only members of your church. This is what Dr. Hicks wants to do. This is the neighbors across the street that don't even come to First Baptist, if they're there. But you said, we care about the community. And that's what we want to see. So once we do that, our healthcare system will be happy to see that we are making a difference. And we hope other systems will join the same and reach so many Hoosiers that may need help.
So when you say you would like to see Indianapolis a healthier community, are you speaking of health that involves the physical health, the mental health, and the spiritual health?
So not only Indianapolis, our leaders here at IU Health, we talk about making Indiana a healthier state. So wherever we rank around the nation's health, we want to, be ranked better. Maybe we'll be #1 in the nation. If you go to Indiana, you'll be healthier. So in any outcomes, whether it's diabetes, whether it's hypertension, so that we manage, really, we take good care of our people, of our citizens. They are well educated about the disease process. And we hope that Indianapolis do the same. We start right here in our own zip codes, and then it permeates outside through education, through engagement. Yeah.
All right, good point. Good point. Before I move to the conclusion, I want everyone to understand the depth of this. This isn't just, "Hey, how you doing? Can I bring you something to eat?" it goes a little deeper, and I kind of glanced through the training manual, and you have a model in there. I think it was called the 5 pillars or 5 elements of compassion. Are you able to kind of state those and how those different areas can help someone heal?
Yes, we are working with an organization called Pathways out of West Coast and Seattle, Washington, that have put together this companionship training model that we have put it in hands of our connectors and our lead connector at First Baptist. So we just started that training, but the training is more to educate our connectors on the ground about companionship. You know, this about, and Stephanie alluded about one. I'll just talk about one of the main pillars what have is listening. How do you listen attentively so that they know, somebody can know that you are hearing them? So we try to focus on that this is not about finding what could I say? Finding a solution by yourself. Say, let's Stephanie is talking to you as somebody who's going through a health crisis. It's about listening to you. It's about walking with you. It's about Stephanie making that phone call to IU Health that, I'm learning a lot. We may need food here. Do you have any resources at the hospital that can help? Instead of a person struggling out there to find should I call? Stephanie is being that advocate, but a good listener who said, hey, Shadrach, we need food access. What can we do? How can we do together so we can provide that? Hey, Shadrach, we need transportation here. Transportation is a problem. How can we work together to provide transportation? So stuff like that, that's what we are teaching, that, don't carry the load by yourself as a connector. You have friends on this side so that we can walk alongside together. So like addressing one of those questions, being a companion, being a good listener.
So
Stephanie,
being
any other pillars?
barrier. I didn't hear your question.
I was asking my colleague Stephanie to see if she wants to add another pillar because she's been through this. She's going through this process right now.
What I like is I agree 100% of what you said. It is the process of learning to listen to hear as opposed to listening to respond. But what we didn't mention was that we have social workers that once we assess what it is the patient is trying to tell us, and we're not doctors, we're not playing the role of doctors or nurses, but once we assess what it is that's missing, what it is that's stopping them, what they're stressed out about, why they can't heal the way they should, we have social workers we can contact. And you yourself, Shadrach, said that we are in the process of getting that social worker on board. I can give them a call. Our team will say, hey, we feel this person needs this. First and foremost, I hate to say it, going back to the HIP project, people had so many problems just trying to get a hold of their social worker so that they can talk to him or her to go forward and help them to get the proper care that they needed. I'm just happy that we have someone on board where we can cut through all that, the weeds and the forest of that and get to that social worker so that that patient, can get the care and get, the resources that he or she needs. Tanya, you and I probably, especially in your position, how hard it is to get a hold of a social worker because they're so overwhelmed. There's, I don't know the numbers, but I would imagine 20 plus patients to each social worker. So how do you give that one-on-one, that's needed for that particular patient? So hopefully we can provide that. We can provide that for both the patient and the social worker.
Right. So it's a combination of things. So what I'm getting from this is that this is developing our Christian walk as mat carriers, as burden bearers, as really putting love into action and helping someone through their healing process, that in this manner will help healing in a total package, not just one particular area. And it's the support, it's a layered effect. As you help the patient, then you're helping the social worker, and it's helping you, because it's all about loving one another. And so this is definitely impacting our community. So as we come to a conclusion here, I would like for you guys to share how someone who is interested in becoming a part of this program, how they would go about that, what the time frame as far as the time commitment is, and just how that all works, so that because I just know there's people like on their seat, they can't wait to help with this, because this is in the trenches, this is real work, this is loving thy brother.
Yes.
Yeah, so on the end here, on the IU Health side, so we will identify the patients that may sign a consent about this program. They'll be offered about it here at the hospital. So we said, hey, we have this program for congregational partnerships. We have companions in the community that live around your neighborhood and can reach out to you. So if somebody signed a consent and said, I live around Faith Baptist Church, who is one of our partners, we'll reach out to their team lead, Stephanie, and Stephanie will reach out to that particular patient within 72 to 78 hours and just establish that contact. So that will be already consented by them before they even leave the hospital to want to be part of this program. So when Stephanie reach out to them, they're expecting that call from Stephanie. And the key is just to establish that relationship, being a companion, being a good listener in the community. Yeah. So, but for the Christians in our community who are hearing about this, they can always reach out to us here at IU Health. In fact, they can email me, Shadrack Kamwendo at SKAMWEND@iuhealth.org about their interest, if their congregation would be able to, wants to also do the same thing like First Baptist is doing.
Okay, good. All right, Stephanie, you have anything you'd like to add?
I think everybody can tell I'm very excited about this. I'm honored and I'm so proud of my team. And I look forward to working with my team and Dr. J and Kamwendo. And I'll go out on a limb and say in 6 months, maybe in a year, we're going to turn this thing around. We're going to make you all so very proud of the healthcare system in Indiana.
Good deal. Great deal. Great deal. So I want to thank you all. I would like to thank Jay, Shadrack, and definitely Stephanie for being a part of this interview today. I would thank Dr. Hicks for bringing us all together. And I'm so happy that you guys are putting your hand to this good work in helping heal people and helping to build the kingdom and putting love into action. This is real community impact. So I wish peace and blessings to you all. You have a great day, and we are definitely covering you in prayer throughout this journey. God bless you all.
Thank you so much.
Thank you.